92.3. That's right, WDAO. It's Footsteps for Life here on a beautiful Saturday here on WDAO. And we are always excited to have Dr. Tanisha Richmond with us. Dr. Richmond, of course, is our local podiatrist and foot specialist. Her offices are located inside of the Dr. Charles R. Drew Health Center. That is 1323 West Dr. Martin Luther King Jr. Way. You can give her a call today at 937-457-1210. You can schedule an appointment at 937-228-3668 or visit the website for more information at Richfeet, the number 1 at gmail.com. That's Richfeet, the number 1 at gmail.com. And we're going to say good morning to Dr. Richmond. How are you?
Oh, I am wonderful, wonderful.
Are you stepping in the name of love today?
Stepping around a lot of mud.
It's one of those kind of times. Today,
I know. We're going into spring. Yes.
We don't have any snow and the rain
Yes.
is gone, so we're good, right?
Yes.
It just seems like you were just here, and of course we know that you're here on the fourth Saturday of every month. So for
Yes.
those of you that are keeping track, you always have asked us, please give us the next date. The fourth Saturday
Saturday of-
will be March the 23rd, so mark that down. March the 23rd,
23rd.
she will be back with us. But today, Dr. Richmond, wow, you have had a lot of people email us with questions,
Okay.
which is great. And so we want to try to address some of those questions today. But for those that may be listening for the very first time, can we just do a brief recap, a brief history, share with them about how long you've been here in Dayton as our local podiatrist and foot specialist, and then we'll go right into the questions.
So I've been here for 10 years. Came to Dayton, Ohio in 2005. I did a 3-year primary care and surgical residency at the Dayton VA. I started looking for a mentor, an African-American mentor, and found out there was no African-American podiatrists in the city of Dayton. And Dayton has a wonderful organization, the Gem City Journal Club, which is a mixture of multiple specialties, African-American, all different ethnicity, races, specialties. And they really supported me and helped me and referred me most of their patients to take care of their feet. And I've been here for the last 10 years, plan on retiring in Dayton, Ohio. And, you know, I love Dayton. I love the city. I love the airport. It's a wonderful airport because I am from Louisiana, so I can fly home easily or travel easily. And I like where I live. You know, Dayton, I call it big country, big city, big country, little city. You can do things you want to do in Dayton, or you can travel, and everything's about an hour to 2 hours around you. So if you, like I was listening to the radio today, we got some good concerts coming up. Medea's coming. You know, Dayton has a lot to do.
So tell us why, and for those that don't get to travel much, tell us why you have such an appreciation for the Dayton airport. Share with us. Tell us why. And tell us why, because you experience other things, obviously, because you travel a lot. So
the speed of going through TSA, I do have TSA pre-check, which allows you to go through the short line, which is even faster. But, you know, I've flown out of Denver, and that's taken about 2 to 3 hours to get out because of the marijuana. They have dogs, you're getting checked. And then Dayton, you can get to the airport 30 minutes before a flight and fly out. I mean, I've never done that, but you can. And then in Dayton also has lovely charging stations for your phones and other appliances. So it's a nice little airport. I mean, for someone that flies as much as I do, I really appreciate the size of the Dayton airport. And when I land, I know I'm home. Because if you fly like into Dallas or these other, Atlanta, the world's largest and busiest airport, it's an experience, especially if you don't fly a lot.
yes, exactly.
Mm-hmm.
And you'll be very much informed when you go to Atlanta, when you could travel there and you realize, oh my God, it's very busy.
Oh yes,
and
it's a city.
It is. It truly is. And a lot of people think that it's LAX.
Yeah.
That's the largest. It is.
No, it's Atlanta.
Mm-hmm.
It's Atlanta.
Yes.
Yes.
So we're going to talk about the feet today, and we want the listening audience to just capture in on what you're going to talk about today, Dr. Richmond. And of course, we want to address the questions that have come in, and they're kind of back and forth, different things, but they're very good questions and concerns, I guess, that the listeners have. So let's address the first one, ingrown toenails.
Okay, so ingrown toenails are very common. So an ingrown toenail is the way the nail grows and sometimes into the skin. So the body will respond to the nail. It's usually on the outside, usually the big toes. The body will respond to that nail like it's a splinter. So the body will keep attacking that nail until that nail is removed. So in some people who are healthy, or not healthy, they'll try and do bathroom surgery at home. They'll try to cut it out, and then they'll try soaking it, doing other things to it, and it still doesn't resolve. At that time, it's time for you to come see a podiatrist. I always tell patients when it first starts to bother you, go ahead and make an appointment, come see me, because I have the tools to cut it back with the smaller nippers and things like that, more aseptic, clean environment. I can order you ointments, put you on antibiotics if you need it. And generally, most people don't come to see me until it's infected. And then at that point, lots of times we have to physically take out the nail border. And that's when you have to do the 4 injections, because we have to block all the nerves around the toe and take that border out. And it is a painful procedure, but that's why I always tell people, try and come see me when it first happens so I can do something that doesn't cause you any pain.
Okay. And so why does the those toenails, why does that hurt, the ingrown toenail?
It's just pressure. Usually it's pressure because that nail is pressing on the skin. Or like I have a favorite, well, they're not a favorite pair of shoes, shoes that I like to wear, and a day or two later I have an ingrown, or I start to feel pain. I have to go and cut it back until I get some relief. And it's just pressure. That nail is pressing down on the skin. So, all the nerves and everything are sensing that pain. So once you take that nail, usually if I cut the nail back in the treatment room and I press on it, the pain is gone. It's just you get the relief from just cutting that nail back.
Okay. All right. The next question we had come in. What does that mean when your big toe swells?
That could mean a lot of things.
Okay.
Because it could be gout, it could be infection, you could have broke it. It's not something you can just tell a person what's wrong with their toe. You'd have to have some history, and you would have that person's foot in front of you so you can see exactly what's going on, because a person can present with a red hot swollen toe, and that could be gout, and it could also be an infection. So you would have to see the person, get a history. You may have to do blood work. In the case of gout, we have to check something called uric acid levels. So in a person who has gout, they break down protein incorrectly, and when they break it down incorrectly, uric acid goes into the blood, and it makes little crystals. So our white blood cells thinks that's an infection, and the little crystals like to hang out in our most distal joints, which means the joints furthest from our body. So our big toes likes to hang out in our elbows, sometimes our hands, and then the white blood cells attack, and you get basically like an infection response. But most people say gout attack is pain like they've never experienced in their life. So lots of people come in, they're like, I think I have gout. I'm like, no, you don't. Just by the way they say it.
Right.
Now, if they're limping, they're in pain, they're wanting pain meds, they're crying, they're barely walking, then I think they may have gout. But if they just come in and casually and say, oh, I think I have gout. No. You don't have gout.
Listening to, what's his name, Dr.
Google.
Yes, Dr. Google.
Yes, Dr. Google, yes.
So the next question is relative to a conversation. It seems like you almost hit on every time you're on, and that's athlete's feet.
Yes.
And I believe maybe this, I don't know, could have come from the same lady that really is struggling with an issue she has with her husband.
Yes.
Who has athlete's foot. So the question is directly, can you wash your clothes together with things, when a person has
athlete's foot?
Or should you wash them separately?
Well, probably socks I would wash separately and bleach them.
And do you need to pre-soak them?
No. Probably just throw a couple capfuls, especially all your white socks, bleach them. But another thing about you can move your fungal infections from your feet to your groin when you put your socks, your pants on, your underwear on. So you want to put your socks on first, because athlete's foot in the groin is jock itch. So it's just different fungal infections.
So that's a different type of fungal
It's probably
infection?
the same fungus. It's just in a different place.
Okay, gotcha.
So, but and generally, if you think you have athlete's foot, you don't want to be touching your feet a lot with your bare hands, because then you can get it on your hands. Or you don't want other people touching your feet. Or you don't want to share your shoes and socks. Mm-hmm. And if you have a tub or shower, you want to get your little bottle of spray bottle, mix it with a little bleach and water, clean it between you, so you're not spreading it to everyone else. And then you don't want to walk barefoot in your house, because you can drop spores, and then people can walk behind you and spread it that way.
Now, what's interesting is there's a two-part question to this, and the second part was, she says, he says, I know that Dr. Richmond cannot answer this directly, but can she please help me understand why is it so gross?
It's just it's an infection. Fungus do nasty things. They smell nasty, but also you don't know what exactly is living on him. So sometimes it can be fungal, it can be bacterial, it can be viral, but that's why we need to see it. And then in some cases we have to culture it and see exactly what's living on your skin. Because sometimes there's a virus, a bacteria called Pseudomonas, and it loves to live between people's toes, and it stinks really bad, and it's green. So if you have a green tint between your toes, you could have something called Pseudomonas, and most time for that you do have to go on oral antibiotics to kill it. So it's not nothing you can buy over the counter to kill it. And like I tell people, with any kind of skin problem, try something over the counter, but if it's not resolving, if it's not getting better, then it's time to come in.
And how often should we examine our feet? You know, we wash our feet every day, or at least
daily.
we should.
Look at them daily, especially if you're diabetic. If you're in renal failure, heart failure, any major health problems, say you're on medications that can affect your immune system, like chemo medication, if you have HIV, any kind of systemic health problems, you should always just check them, look at them daily, because things can just go bad overnight, especially like in my diabetic patients, my patients on dialysis, or heart patients, especially like a person with heart problems. If they wake up and suddenly their feet are swollen, they're hurt, they could be going into heart failure. Or if they're having kidney problems, they could be going further into kidney failure. If they're having liver problems, they could be going further into liver failure. So it's so many different things that you should not ignore. At least I always tell them, just call your doctor's office, talk to a nurse, and ask them, is this something I need to come in for?
Okay. So let's talk a little bit about the itch, the rashes that appear maybe around the ankles, on the top part of your foot, and maybe described as maybe eczema or psoriasis. She wants answers about the itch and how to handle that.
Well, in that case, that could be something else as well. So sometimes when people have a lot of itching around their ankles, especially if their ankles are turning colors, like shades of brown, black, if they're white and they're turning pink and red, that could be something called venous stasis dermatitis. So that could be where the veins in your legs do not work, and they're letting the blood come backwards, and it's pooling, and usually it's around the ankle area. Like you'll see people in the mall, they'll be walking, they'll have huge legs, half their legs are white, the other half's brown or red, or half their leg is brown and the bottom of their legs are black. Lots of time that's called venous insufficiency. And then they get a rash, it's called stasis dermatitis. That's just the irritation of the iron leaking into the skin and causing irritation. Lots of times we tell people to try some hydrocortisone cream over the counter, but still you would still need to be seen first to make sure that's what it is. Because sometimes, like you said, it could be eczema, it could be psoriasis, but you can't tell someone that without physically seeing, and then examining the rest of them, because it could be all over their body as well. Like I have a patient, she has severe eczema, so it was on her hands, her feet, it's everywhere. So she's also seeing a dermatologist as well for it because she needs strong medications to help with that.
Like by medicine by mouth or something?
There's a lot of new meds out now for psoriasis. Like there's even injections, pills. There's all kind of treatments for the more severe cases.
Okay. What are plantar warts?
So it's just a wart on your foot. So you can have warts on your hands. You can have them anywhere on your skin. But in plantar warts, it's just warts on the bottom of your feet. Generally, I see it mostly in children. I may see it every now and then in adults, but not that often. So it's mostly on the bottom of your feet. Generally, you get them from walking barefoot. People who go to the gym, children generally get it because they'll walk barefoot anywhere. PE, the pool, go on roller skating, ice skating, where you're wearing other people's shoes. You want to spray all that with Lysol. And then, of course, the mainstay of treating warts, we try to freeze them. There's warts creams. And then sometimes when they will not die because they are viruses, sometimes they do have to be cut out or surgically burnt out. I've only seen that maybe once or twice where I had to send someone to surgery to get them cut out. They were so bad.
Wow. We had a lady that thought it was very interesting. When you end your show, you always say something to the effect of take care of your feet. You only have two.
Yes.
So she said she did some research and she said she realized after you had mentioned that we have 52 bones in our feet. And they make up about 1/4 of all the bones in our body. And she thought that was fascinating that many bones, 1/4 of all the bones in our body are in our feet. And she says, now I see why Dr. Richmond says take care of your feet. You don't have but two. So that many bones, and
yes,
that's a lot.
Well, I always go back to the beginning when we were created. So our feet are what's called mobile adapters. And the reason we have so many bones in our foot so we can be mobile. So like say if you're walking barefoot outside, you step on a rock, our foot can move to stabilize itself because of all the different bones in our foot. And then all the different ligaments, all the different tendons. The way we walk, our gait is designed for us to adjust to our terrain. So, but if we're not used to walking on that kind of terrain, like say sometimes we'll see problems with runners who walk on slanted surfaces, like they're not running on a flat surface, and they'll say, well, this side of my leg hurts. Well, that's because you're now using muscles on one side of your leg that you weren't using, or tendons or ligaments. But we were designed to be mobile. So when we walk flat, plantarly flat, we can adjust. That's why when people wear high heels or these I don't know what you call those boots with the one heel, it's very unstable because we're not designed to walk that way. We're designed to walk flat on the ground. So when you put us in a 4-5 inch heel and we hit a rock, we just fall over because we weren't designed to walk like that. We were designed to walk with our feet flush to the ground.
Wow.
That's how we were built.
Amazing. Yes. So we talked about exercise. What exercise is safe for your feet and good for your overall health?
Well, it's more just giving your foot support. So when, if you're out doing, like say you're doing basketball, you want to wear high top shoes. You want to wear something that's going to give your ankles more support because of the motion of basketball. You're going side to side, you're stopping a lot. So it's all dependent on what you're physically doing. If you're a runner, you want to wear a running type shoe. And if you're doing excessive activity, you want to wear some orthotics in your shoes, which are the inserts. So the orthotics just bring the ground up to your foot. They can help control the motion of your foot more. So it's all depending on what you do. Like we had a case of a young teenager whose toenails are turning black. Well, she's a runner. So she's constantly hitting the tips of her toes in her shoes. And that will continue as long as she continues to run because it's just the trauma of her hitting the tips of her shoes. So and then you also see that a lot with stop sports, so like basketball, football. They'll get like subungual hematomas, the dry blood under the nail. And lots of times when that nail does fall off, it comes back ugly or dystrophic. So it just depends on the trauma. So it's basically you can't go work out in some flimsy little shoes. You got to get a good stable shoe, and then it needs to be specific to your activity.
Support.
Yes, you can't, I don't know, wear the little ballerina shoes to go run a mile. You have to wear something supportive.
You're listening to Footsteps for Life here on the fourth Saturday of the month. And of course, we're excited each and every fourth Saturday of the month to have our local podiatrist and foot specialist, Dr. Tanisha Richmond, in the studios with us. You can give her a call now at 937-457-1210. We're going to take a short break, and when we come back, most Americans are not very, very familiar with it till after it's over with. But we're going to let Dr. Richmond share with us an exciting day that's coming up on Tuesday, March 5th. See if you can figure it out. We'll be back in just a moment.